Hi, in this video I am going to demonstrate you the OPD clinical workflow in Foss software. I am logging in with one user, the doctor user. So once login, you can see the interface like this: one left hand side screen and then the right hand side. Left hand screen is basically a patient registration list view, and on the right hand side you will see the details of a patient. Okay, so let me quickly add a new patient, register a new patient for you. You can like create an appointment for old patient or other new patient as well. I am going ahead with a new patient. So let me just fill basic details for the patient. Let's say Steve John is my patient, and I'm entering the patient mobile details. Yeah. You can capture other details and select the consultant doctor here, and then go ahead with the saving the details. So once you save the appointment, system will pop up for the billing consultations. The consultation amount can be taken from the patient. Okay, so I'll take a consultation fees and then save it. So once the payment is taken, you can just check in the patient and then go ahead with the clinical workup. So click on this new button, open a iTemplate. So the iTemplate Proforma is open. Now there are steps available here. Like if you want to capture the history, then click on a history section. Let's say chief complaints you want to capture. Click on redness, pain, then respective sites of a patient. Let's say where the problem has the patient is facing an issue, and then the durations. And similarly, you can capture other history like ophthalmic, systemic, and then drug allergies and vital signs and all that as part of history. Now, once the history part is captured, you can move ahead with the refraction. Again, the standard ophthalmic charts are already available here. You don't need to type and do that. So simply start clicking on the respective readings that you would like to capture for. Let's say like I'm capturing for UCVI and pinhole. Similarly, you can capture IOP by simply dragging these things. You can capture multiple IOPs in case you are taking with a different methods. Let's say AT&T, then NCT and other methods. Then capture the refractive readings here. So there are ways to capture the refractive readings. One way is you can, if you are keyboard friendly, then you can just start typing out here like simply, or you can use this fill option where you will again get a standard ophthalmic chart and then just keep on clicking on the respective values of a cylindrical and spherical and then axis values for the patient respectively. Right. Similarly, you can capture dry refraction, dilated refraction, PZPs. You want to advise some glass prescription to the patient, you can advise here. Okay, so a lot of things you can do. Almost all the things that you do in as a part of your refraction workup is all possible here, like retinoscopy, keratometry, Amsler, contact lens. Everything is possible here where you can capture, right? Then go ahead with the examination part. Again, in examination, let's say if you're looking at a like pediatric patient, then you can have a squint evaluation here as well. Again, click on yes, and then opens the squint evaluation chart completely. You can perform all the tests related to the squint evaluations. Then there is other options like for the reason wise examinations is partly listed out here. Let's say if you want to capture some findings related to the appearance, and then click on yes, and then the respective findings will be captured here. Let's say if you want to do some diagrammatic view, or you want to represent some findings with the help of diagrammatic. Let's say in cornea you want to represent some things related to the diagram. Then you click on the cornea, and then there are options here available like where you can add the slit lamp diagram or a cornea diagram as well. Click on this cornea diagram and it opens a cornea diagram where you can highlight whatever the things you want to highlight, or you want to write something comments here and write the comments here like simply and save it, or you want to do with some color and all that. A lot of options are available which we can explore all the things here, right? So once things are done, you can just simply save the diagrams, and like all the reason examinations are added like fundus, gonioscopy, like iris, pupil sizes, anterior chambers, everything is possible here. Like I have just captured for so one side of eye, you can simply capture for other side as well here by simply clicking on the plus button. So if you click on plus button, it will expand for the more findings to capture. Then go ahead with the investigations. Again, you can advise reason wise investigation, means specialty specific, or you can simply search here investigation, and that will upload. So you can advise one by one investigations, or you can like create your own set. Like I have created here cataract eye investigation, then in a one click I can advise so many investigations, and this will save a lot of time for user as well, and I just need to save the laterality. Similarly, lab investigation can be advised. Then you can move ahead with the diagnosis part. Again, the diagnosis, complete diagnosis library is available. You can simply search here the respective diagnosis and it will like suggest you to suggest. Or else the most commonly used diagnoses are already given on the top. So click on cataract and then select a cortical is related to diagnosis that you want to advise. Then say save changes. All these diagnoses are already all these diagnoses are ICD standard diagnosis, and you will have the codings associated with the diagnosis. Let's say if you want to have some provisional diagnosis, then you can also click on it and then start typing the provisional diagnosis as well. Then go ahead with the other part of advice where you can advise the medications. So when it comes to medications, like you will have a provision to search a medication from your associated pharmacy store as well. Let's say if you have pharmacy store, in-house pharmacy store and integrated, then you can see here the stocks availability can also be shown here. And there are different source that you can like pull out the medications from, where the pharmacy drug index and also my medication list, where you can prepare your own set of medication list and upload into the system. Then go ahead with the procedure part, where you can again advise the surgery to the patient. Again, specialty specific surgeries are also available. Let's say retina, glaucoma, cataract and all that, you can advise the surgeries. So then referral is also available, where you can use this for cross refer consultations or referring to the different facility. Let's say if you have multiple facility, and then you can refer to other facility, or if the patient is diabetic and then you want to refer it to some other organization for diabetic certifications and all that. Let's say if you are planning surgeries and all that, that will again will be helpful. Then go to the advice, where you can write your management plans and all that. Let's say if you are planning for some surgeries and all that, or if you are want to call this patient for follow-up visit and all that in future, then again you can choose the date, respective date, and create an appointment. Again, this date and these things can be completely configured, or we can like map it to the time slot based on the doctor's availability and all that. Time slot configuration can also be done here. Right, then you can select the basically this instruction sets as well from this. These are basically the custom set that you can like add as per your basic custom things. So these are all there are few available as part of predefined, but you can also customize things here. So once things are done, like clinical workup is done, you can simply save this, and then this is how the proforma will look like. So this proforma you can again now choose what to take on a print, and like what you don't want to give on a print, just simply unclick here and then take a printout. So the printout will look like this. So this is how the printout will look like. This completely you can customize the header and footer and whatever you want to have as per your hospital logos and all that, that can be customized. Right, so this is the complete OPD journey, how you can like capture the details of a patient in OPD and all that. Thank you very much.